Coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Quarantine helps prevent spread of disease that can occur before a person knows they are sick or if they are infected with the virus without feeling symptoms. This video will explain the quarantine measures to overcome COVID-19 safely.
The guidelines for home quarantine is intended for anyone who believe they have been exposed to COVID-19 and are required to be home quarantined to prevent community transmission. Number 1. Allocate a separate room from other household members. Number 2. Maintain at least 1 meter distance from family members. Number 3. Use separate bathroom as other household members if possible. Number 4. Minimize any visitors from the house. Number 5. Wash your hands frequently for at least 20 seconds at a time. Number 6. Avoid touching eyes, nose, and mouth with unwashed hands.
Number 7. Check your body temperature using the body thermometer twice a day and check whether you are developed any symptoms. Number 8. Get rid of disposable face masks and gloves after being used. Number 9. Use separate dishes, drinking glasses, utensil, towel, bedding, and other items from your household member. Lastly, number 10. Wash used utensils, clothes, and other items with soap and water. For the quarantine requirement, there are a couple of requirements to isolate yourself during the pandemic, such as isolate yourself for 10 days if you are tested positive or have any core symptoms that are not related to a pre-existing illness or health conditions. Besides that, you need to quarantine for 14 days if you are a close contact of someone with COVID-19 or if you have traveled outside the country.
Here are the self-quarantine measures if you have been diagnosed with COVID-19 or you are a close contact of someone with the virus. Step 1. Stay home for 10 days or more and you must avoid going to public places. Step 2. Get tested 5 to 7 days after your exposure to a person with COVID-19. Step 3. Monitor your symptoms by frequently taking your body temperature twice daily and check for any other developed symptoms. The last step is to take care of yourself and reach out to any healthcare provider if you have any concern about your health.
Quarantine versus isolation. What is the difference between quarantine and isolation? Quarantine keeps someone who was in close contact with someone who has COVID-19 away from others. Isolation keeps someone who is sick or tests positive without symptoms away from others, even their own home. The guidelines for quarantine and isolation are also different, as the best way to protect yourself and others by quarantine is to stay home for 14 days after your last contact and stay away from people who are at a higher risk if possible. As for isolation, stay home until after at least 10 days, since symptoms first appear, or at least 24 hours with no fever, without fever reducing medication, and or symptoms have improved.